We shall have the networking during the lunch. And without a further ado, I would request the convener and moderator, Dr. Harsh Mahajan, Chair, FICCI Health Services Committee and Founder and Chairman, Mahajan Imaging and Labs. We also invite on stage the esteemed panelists, Mr. C.K. Mishra, former Secretary, Government of India. Welcome, sir. Ms. Navika Kumar, Group Editor, Times Network and Editor-in-Chief, Times Now Navbharat. Professor Dr. S.K. Serene, Director, Institute of Liver and Biliary Sciences, Dr. Rajiv Singhal, Co-Chair, FICCI MVT Committee, Founding Member, MDN Group CEO, Maringo Asia Healthcare, and Dr. Amrish Mittal, Chairman and Head of Endocrinology and Diabetes, Max Healthcare. Can we extend a very warm welcome to all of the dignitaries on the dais, please? Thank you. And I now request Dr. Harsh Mahajan to kindly take over, please. Thank you.
Thank you very much. I think we've had two scintillating sessions in this hall since the morning, and we hope to carry on that trend. And this session, of course, is on building bridges of trust. And can that lead to strengthening of India's healthcare ecosystem? Having said that, what really is the definition of trust? Confidence in someone or something, to believe that someone or something is reliable, honest, effective, or has integrity. That is trust. And to discuss trust, lack of trust, trust deficit, there are so many terms in the healthcare system in our country. I have a great panel. In fact, most all are stalwarts of healthcare, with one exception, who is the stalwart of media that we have here, Navika, a dear friend, and who is, as you heard, group editor of the Times Network, and also both Hindi as well as English, equally adept at both the languages, also Punjabi. I'm sure there will be a Punjabi channel which will come in the months and years to come. Bengali bhi bolte hain. So that multilingual. We have Mr. C.K. Mishra, one of the leading IAS officers that we've had in this country. Became an IAS officer when he was 21 years old and served the country ultimately as Secretary Health and Family Welfare, and also went on to be the Secretary of Environment and Climate Change. Two things which now we realize have so much synergy. Also, 2017, the latest healthcare policy that came, he was one of the drivers of that policy. Dr. S.K. Serene, renowned gastroenterologist, hepatologist, who's done wonderful work, research, known throughout the world as a researcher for liver diseases, especially hepatitis. Apart from that, having led the NMC in turbulent times, and then being the founder of a unique experiment where he set up the Institute of Liver and Biliary Sciences in Delhi under the aegis of the Delhi government, but separate from it, independent in his own right, and also a public institution which charges significant money. And I'm sure he'll be able to bring perspectives as to the trust and how to create it. Dr. Amrish Mittal, renowned diabetologist, endocrinologist of the country, who also apart from being a consultant in the Max Hospital currently, before that worked as a professor at SGPGI Lucknow, then was at Apollo, and now Medanta, and now Max. And having been involved with teaching both in the public and the private sector through these years, also for 5 years was a member of the National Health Authority on the board and chairman of the AIIMS at Gorakhpur. And finally, my dear friend, and I think the youngest, except Navika, the youngest on the stage is Dr. Rajiv Singhal, who from being at the escorts, from the FMC, then multiple roles in managerial positions at the escorts, and now has become the founder of a chain of hospitals, rapidly expanding, Marengo Asia, 5 hospitals already, and I think the 6th and 7th are already on the anvil. So he will give us perspectives into trust or lack of it, corporate world of healthcare. So we have a diverse group here, and we hope to, Amrish, I talked about Amrish. Yeah. So trust, like I said, to believe that someone or something is reliable, honest, effective, or has integrity. So I start with you, Dr. Amrish Mittal. Trust, how important? Is it necessary? Yes, we speak from here. Just to, yes, this is going to be an informal discussion.
Sure.
You make your point, anyone wants to add to it, they can. They want to refute something you've said. We have Navika here, so
Yes.
we will follow some of her lead as we go forward in this panel discussion. There'll be nothing formal about it. Please,
So,
how important
thank
is
you.
trust?
Yes. Thank you, Harsh, for having me on this very elite panel. And I knew this was informal, but I scribbled some points in the car, in the sort of moving car on Delhi roads on the way here to get my thoughts together. Because trust is something we deal with every day. And in fact, it's the lack of trust that creates a problem. You don't notice trust when it's there. You only notice it when it's missing in your interaction with the patient. And that's when it hits you. Now, I think it's important to understand that there are certain components to trust. So if you're a patient going to a physician, there are certain guidelines or certain standards which you expect. The first of which, that your doctor has to be competent. If you have a doubt about the competence of your doctor or your healthcare provider, you will have difficulty in trusting that person. That's the basic. Then the provider has to be compassionate. Now that's a very subjective thing. Many times doctors feel they're very compassionate, but patients feel they're cold or insensitive. Sometimes doctors who like to be very frank, then patients don't like that either. They say, "Oh, to saaf bol diya sab unhone to ki kuch bhi ho sakta hai." So on the other hand, others who sugarcoat it too much, patients don't like that either because they think they never gave us the real picture. So there are very nuanced, but compassion ultimately shows through. If you are compassionate for your patient and caring for your patient, you can't hide it. Maybe one interaction, but a couple of interactions, I'm sure it comes through. So competence, compassion, confidentiality. The fact is becoming more and more important these days, especially when you treat people from different strata of society, that you need to keep your information about the patient to yourself, not even discuss with colleagues who are not involved in the care. And I think that's very important. Communication, of course, I've already mentioned compassion and communication, but communication skills vary a lot. Remember, in medical school, we are not taught soft skills. So soft skills that you have, your ability to converse with your patient, your ability to communicate bad news, is dependent either on the way you're made, the way your family is made, or the way your professor was made. You have professors who are very tough and very sort of, old British style, and you may follow the same path. There's been no structured attempt, if I'm not wrong, so far to teach soft skills to doctors, which is actually very important. And that's a very important component of trust. So again, competence, compassion, confidentiality, and communication. I think these are the components of trust. So why do we think that patients often mistrust their doctors these days? And more will be said about it. But just pointing to two major areas. Number one is financial. If there is no money involved, the trust factor goes up much higher. People are much more trusting of people where it is not transactional. Moment you're paying money for a service, you think you need that, you deserve that, and the person might be doing things for financial gain rather than for your benefit. So whenever there's a money factor, that's natural. So, and it's also, I mean, even in our Shastras, even Charak wrote that charging an appropriate fee for a good doctor definition, among other things, was charging an appropriate fee from your patient. So it's not that paying a fee to a doctor is anything new. It is just that in between the system became totally government driven, and that culture of paying fee is now coming back, but people are still suspicious of anything which involves a money transaction. So that is one issue. The other is, of course, actual distrust about industry and doctors, about links between doctors and pharma industry. That has become a huge thing. And you know, anyone who says that all doctors is sab mile hue hain, or sare, they're all sort of hand in glove with the industry, and actually I don't need any medication, like this keeps coming to me on WhatsApp. My blood sugars are 250 or 300, it's fine. It's all created by doctors to prescribe medication for which they get a cut.
So ignorance also
so
on the other
ignorance,
side
yeah.
probably plays a role.
So I think this is very broadly, I think finance plays a huge issue in that. And for doctors, what makes a difference with the patient is now, especially with surgeons, is the fear of litigation and bad press or bad, not necessarily press, but bad social media or whatever, because anything can be, you know, the context to the discussion is not there. But one sentence you speak gets highlighted all across. So, and the last point I'll just say that there is a difference between trust that is a social trust versus interpersonal trust. The social trust is that what is the environment around you? What does the media create? What are people talking? Sab chore hai. Sare aspatal chore hai, sab doctor chore hai. You go with that mindset. Yet, if you will ask, 90% of the people in this room will trust their physician. So interpersonal trust is far better preserved than social or hospital system-based trust. So I think these are the
Thank you.
points
Thank
I'd
you
like
very
to
much,
start.
Amrish. I think you've set the ball rolling very, very nicely with your thoughts. It is said, you know, about medical practice, and it may be true actually for anything. The ABC of practice, they say. A is availability. You may be the best doctor in the world, but when the patient needs you and you're not there, you know, how does it matter? B, behavior. You know, that is compassion, the hand on the shoulder. And C is competence. And in fact, some people believe it is in that order, that competence comes after A and B. So, you know, you put it very nicely. And now let me move to Navika. And you said 90% of people in this room would trust their doctor. So why is this feeling ki sab chore hai? Why is this feeling ki loot rahe hain? So Navika, let me ask you, do you trust your doctor?
I think when you say, do you trust your doctor, I think all of us need to trust our doctor. It's a need within us. So trusting the doctor is something that is inbuilt in us, because you go to a doctor when you have a problem. In India, I don't see too many people even today going to the doctors when there's no problem. It is when you have a problem that you go to a doctor and you're looking for trust. You're looking for somebody to solve the problem, tell you that whatever you're fighting, whatever disease, illness you're fighting at that point is handleable, can be figured out, can be treated. So they're looking for trust. So to begin this, the social environment is not, very conducive to trust. I think the public is waiting to trust because they want to give this problem which they don't understand themselves to somebody who will solve it to them. Where are the impediments? Where do the mind blocks come in? The choices for individuals are between a government hospital or a private sector hospital. In the government hospitals, you know what goes on. If you're a slightly middle class or upper middle class person, you just can't deal with the sight of the things that you see. Because I don't know, there might be many people like me. We are queasy about seeing illnesses in the corridors, people in pain, people with intravenous stuff lying in the corridors. So, government hospitals always bring those images to your mind, and for some people, it's a no-go area. Unless, of course, you are a government employee. Things have improved, yet you need to know somebody there in the system for attention to come to you. So it becomes a difficult proposition for individuals. And let's come to the other side then. The options are private hospitals. In private hospitals, it's very daunting. The bigger the hospital, the more daunting it is. Simply because specialization has increased so much that you don't know between your kidney and liver, beech ki kahani kaun batayega. So, patients when they go, they need somebody to hold their hand. Specialization, very important. We live in the times of specialization, and we need specialists to handle our special programs happening inside the body. But we also need somebody who's a generalist, a physician, because the physician actually holds you through and advises. You need an advisor as well. Somewhere that gap exists in a big corporate hospital. And may I tell you that even in big corporate hospitals, you need to know somebody. Otherwise, you meet people, pata hi nahi chal raha andar kya ho raha hai. The patient is inside. So communication, to my mind, at the doctor level is important, but at the corporate level also, it's a very important point, because if I have a family member inside, I need to get constant updates. That reassurance or that information is important to me as a family member. So trust has some of these factors where we're looking between two ends of the spectrum. The nursing homes in between, the smaller places, again, are very, very personal oriented. There are some nursing homes that are good. There are some that are fly by night. There is no rating that is available in our system. So who do you trust, who you don't trust, ghar ke paas kaun hai? Some of these factors make, the decision making in a normal consumer's mind. Trust happens, the best of hospitals may fail to save your family member, your trust will be betrayed, even if everything is done. I know it's very personal and it's very tough on hospitals and doctors. But look at it from the patient and their family's point of view. They need hand-holding, and there needs to be, to my mind, some amount of attention paid to handling. Yes, you're not in the hospitality business, but sometimes this is even beyond hospitality, because this is a matter of life and death, and people need to be advised, need to be educated. So, to say that people don't trust their doctors is wrong. They want to. Point is, it is true that some doctors, and one bad fish in the pond does spoil the atmosphere for the others. There are commercial doctors. There are people who will send you through 30,000 tests when they are not required. There are people, who will not guide you well, will not catch. For them, it is commercial. Do we need a rating system? Do we need a system, and that rating system has to be something like people can actually trust?
That is happening. That is
so
happening
there
as we
also
speak.
trust how good is the rating system, because you can pay and get rated the top hospital or the top doctor. The point is, trust is required at every stage, and trust is a two-way street. Trust cannot be only impinging कि आजकल के patients खराब हैं, उनकी families खराब हैं. There has to be a reason why that trust is difficult to come by. And I think what is required is a little bit of ground to be covered on both sides. The doctors and the healthcare systems need to have some specialized solutions for this, and therefore the people who avail of these facilities also need to walk a few steps. We cannot have a situation where a family members have died and we start beating up the doctor. We cannot, that's a law and order situation, and we cannot get into something like that. It has to be a two-way street, and we have to create together a conducive environment for that, because it cannot be done. Solutions cannot be found only on one side. They have to be found together. And I think we need to talk healthcare only as a crisis management system. We have to go beyond that, because there are many things that can be avoided getting into a crisis. And Dr. Amrish Mittal is absolutely right. The pharma company, nexus with doctors, it's not something that doesn't exist. It does. It does. It may not exist everywhere, because no rot goes everywhere. But as I said, a few bad apples can spoil the entire lot. That exists. Hospitals overcharging. For example, I hear this very often when people come to us. हॉस्पिटल में एडमिट हो जाओ तो डॉक्टर राउंड पे आएंगे, 3 बार आ रहे हैं, जिसकी ज़रूरत नहीं है वो भी 3 बार आ रहा है, फिर उसका बिल ऐड हो रहा है. How is that billing system? Nobody is explaining the billing system, especially if it is an insurance case. The billing system is not. The insurance company, Doctor Nexus, Hospital Nexus, there are all kinds of nexus. To clean up and to actually move forward on the road to trust, all of this needs to be looked at. And insurance companies, which is not the subject matter here, more than anything else, need to be looked at, because that is part of the comprehensive facility that a patient or a family member of a patient is looking for when he goes to the doctor. Believe you me, they're all waiting to trust. They just need to be handled in a satisfactory manner. Of course, you can't please everybody, but they need to be handled in a specific manner. Specialization and only specialists handling them may not be the solution.
Thank you very much, Navika. I think you made some really important, great points. One is specialists being available, and for any and everything, one having had to go to specialists. This is something which has been discussed in the previous session, where lack of GPs, general practitioners, in our country, globally, is causing a lot of problem. Specialists look at patients as organs or in silos. You go with pain abdomen to a gastroenterologist, he will handle differently. You go to a urologist, he will handle differently. You go to a gynecologist, she will handle differently. Whereas what one needs to look at, especially at the first step, is maybe a GP or an internist who's able to look at the person as a whole completely. So that is one point you make. Two is about accreditation, about knowing which hospital is good, which is not. And there we do have NABH for hospitals and NABL and NABH for diagnostics, which have been there for a long time, and they do assure some degree of competence in the institutions. These are all institution levels, and now we are going to the next level. In fact, that it's going to be coming out very soon, which is grading of hospitals who have already been accredited, where, you know, just like a 5-star, 4-star, 3-star hotels, similarly, and it's going to be quite a tight way of doing it. Having said that, you know, each and every one of us is part of society. Society, when it moves in a particular direction, doctors, healthcare providers, hospitals, companies, they cannot, you know, be islands within society which remain and retain their ethics while all others have lost it. Having said that, I think the points you made are very, very important. And communication, which, you know, in every discussion that we have, communication comes out to be one of the major factors which leads to lack of trust, not knowing. And this is where I come to Dr. Rajiv Singhal. You know, we hear for the last 25 years, ever since private healthcare actually came to the forefront, where now mostly new technologies, new breakthroughs are coming more on the private hospital side. The government is lagging behind, probably because of paucity of funds, and governments are slow. But even though you've been able to up the, you know, the quality of healthcare, you've been able to bring on the latest technologies, it is, you know, believed and it is spoken that corporatization of healthcare delivery has led to this lack of trust. What do you think? You are building a new chain of hospitals. Already 5 hospitals are there. What are your feelings? What have you seen coming from a government background, then, you know, coming into existing corporate trust hospital infrastructure, and now a purely private equity driven endeavor?
Thank you very much. As rightly mentioned in the beginning, that I am the youngest of the lot, and I think, and the biggest challenge which has been given to me is to carry the, sorry, my apologies. In fact, generally,
महिलाओं के सामने में वो ही यंग रहती हैं. That's a universal truth.
मैंने इसी को जान के इसीलिए आपका जिक्र नहीं किया. So coming back to the point, I think it's good that FICCI has decided to actually include this as a matter of discussion. Sometimes we talk about it, but we fail to sometimes address the elephant in the room. I think this is the biggest elephant in healthcare system, where people are trying to find where is the trust, what is the factor, what is the missing element between the society and the healthcare providers. I think one key word is trust. And why it is happening so? I think Dr. Amrish spoke about it. Dr. Harsh defined it beautifully well, that what is the definition of trust, and Navika took the aspect from the consumer perspective or the patient journey perspective, saying what exactly is the trust. Where are we lacking, in fact? Whether corporatization is the only sole reason to blame the lack of trust, I don't agree to that. Having served in Indian Army, worked in armed forces, coming back to the corporate world, and then basically starting the Meringue hospitals, I think there are certain elements which lead to formation of trust. What are the missing links? Are we transparent to our patients? That is most important component. Transparency is the most important component. Do we communicate well to our patients about the entire episode, the journey, the treatment, the process, the protocols, the outcomes? We are not there. We don't do it. Who's driving it? Whether it is our internal behavior or it is the organizations which demand it, I think sometimes the truth lies in between. The other aspect is, do we hold ourselves accountable for what we do? The element of accountability is the most important component in healthcare, where we need to be accountable to the people who basically walk into our corridors, and they are basically coming with trust. मैं यहाँ इस hospital में जाऊँगा, whenever I walk into this place, or I meet the doctor, everything will be fine and will be taken care. The earlier speakers, they also mentioned about when they go into large hospitals, there is nobody to actually help them in trying to take through that maze, and they are lost. That is where the trust starts breaking down. The billing issues, they are definitely there, but before that, the trust, the element has already, whether they are asking me to go for more tests, are they these, and nobody is talking to them, nobody is telling them what is required or not is not required. I was recruiting a doctor some time back. The doctor asked me a question, what is Meringue policy, what will be my targets? His ask is not wrong. Somebody would have given him a target. Somebody would have spoken to him in that particular language. I asked only two things. I said, these are the two targets. One, do not write a medicine or a test which you will not write for your family members. I said, target number one for you. Follow that principle. Second, whenever patient, there is a dispute between management, so-called management and doctor, only think what is right for the patient, we will never fight. I said, these are the only two principles and these are the two targets on that. Coming back to the very critical question, whether the private equity funds are driving us for profitization, for profiting, I think it's more of a question of sustainability of your business. Every person who's sitting in this room wants to create a business which is sustainable. There is a difference between sustainability and profiteering. So first and foremost thing, the people who invest into you, their objective is whether you are able to create a sustainable business or not. That is first part. So it is a question of good to great or good, or basically your profit and greed. You have to define your benchmarks, whether you want to become a greedy for the profit or you want to make good money. If the organizations actually make good money, they don't have to be greedy. The trust of the society will come back to this. I think we need to work on, last but not least, we are very weak in our audits. I wish if IPO has to be filed for a healthcare organization, the way you look at a balance sheet, there should be the audited report for all the healthcare organizations which is filed to the SEBI saying this is my audited medical audit report which is there, which is mandatory for anybody who is filing for this. It should actually take the form and the shape the way you actually file your audit reports which are signed by all big 4 or big 6 guys. I think we should actually move towards auditing to a very serious level. The clinical audits will bring trust to the people, and we should publish our reports. We do not publish our reports on our website. All the clinical data should be published. So communication, trust, transparency, audit, and accountability, I think, will be the key focus areas for us.
Thank you, Rajiv. This lack of trust in healthcare, or more so corporate hospitals, this is somehow, and you make very valid points of communication again. I mean, that's something that's coming through accountability and how a patient is handled. This is despite the fact that we are the cheapest quality healthcare destination of the world. I don't compare with the West. Our corporate hospitals are 20 to 25% cheaper in providing quality healthcare, even when compared to hospitals in Pakistan, Nepal, Bangladesh, and Sri Lanka. What to talk of others. And so there are some, I think, minor maybe issues which are leading to this, because even when, I mean, the world comes to us for getting their treatment done, and most doctors, the phone is on 24 hours. You're available all the time and responsive. And yet, if this happens, then there are some flaws in the system, and you pointed out a few of them. I'll now come to Professor S.K. Sareen. Sir, you've been a researcher. You are one of the most sought after hepatologists of the country. Patients come to you not only from within the country, but from outside. What you've done while being in a public hospital, G.V. Pant Hospital earlier, the kind of research that you've done has changed the way hepatitis is treated around the world. At the same time, you've been at the forefront in care delivery, and then had the opportunity in between of heading the NMC. We would like to know what you found, how you tried to change things, if at all, if they required change. And finally, you now have been running a private hospital in the public setting. Did you find any change between how patients looked at you and your colleagues when you were in a purely government hospital where no money was charged versus now where there are charges for everything? Please.
Thank you, Harsh, and it's a very educative session and very elite. I will start by asking people, how many of you trust the choice of panel by Harsh? Raise hands. The choice, many do not. So trust is subjective. To make it objective is difficult. Trust is of two types, as Dr. Amrish and Rajiv and Madam said, Navika, of individual or institution. You go to Mahajans, यार अच्छी X-ray होगी, बढ़िया report होगी, time पे मिल जाएगी. Very happy. You go to AIMS, you go because of you go to MD Anderson, you know, here is an institution which has earned a name. So you will not ask for doctors because the policies, the system is in place and you will get the results. Then the question comes of individuals. Now here there is a difference. Let's say you buy Ford car, you know it is tested, or you buy Maruti, you have Euro 7 tested and it is going to be good. But that's not true of doctors and patients because they change every minute. Here there is a huge thing you can't redo or undo if you have made a mistake. So I would say the first part of a medicine is humility, accepting mistakes. If they know in this hospital, and as you rightly said, compassion, but I would add an important part of a doctor's life is humility, to be able to accept your mistakes so that you can do better. And that's what I think in medical education, and I see the President NBE to be part of our learning. We do not. The second part is of policy changes. When we started with ILBS, and I think it was Providence, Madam Sheila Dikshit never asked a question. She only said, Dr. साहब लोग आपको दिखाने आए और अस्पताल भी देखने आए. अस्पताल देखने तब आएंगे जब आपने साफ सुथरा बनाया. So the trust will also come if you are able to maintain the system besides being doctors. So government hospitals, you do have trust, but you do not have that hygiene and cleanliness. So I think, and Mishra Saab was the champion of all this, the government hospitals, if you make them neat, clean, I think people not only will trust but would like to visit. So I think an important part is to have a trust in the institution and of course the systems and the doctors. This session, as I read it, has several things, and you have made to make policy decisions and what can be FICCI's involvement. I have few thoughts on it. First, the competence of the doctors must be known and must be made available. What is an Indian medical graduate? This doctor can handle 650 medical emergency just by doing an MBBS. That part people don't accept. So we should be able to communicate in whichever manner through media that Indian doctors are able to do this. A specialist, MS or MD, or a super specialist. What can he provide? And of course, what he cannot provide. Number one. Number two, as a policy, we should also see that other systems do not denigrate us. I hope you get my point. Several other systems of medicine say, बिल्कुल कोविड में मत जाना, ये डॉक्टर एलोपैथी खराब. We need to understand this, that this has harmed us tremendously. People have gone to other systems of medicines, which I am not against, but we also have to say these are the qualities of allopathy or modern system of medicine, and we must say this is our competence, this is allopathy can do, this it cannot do. All these two are important part. Now, besides having competence, I would also like that when the patient comes, it should be end-to-end care. End-to-end care is, if I am not able to handle, I will refer you to the next guy. You will not let the patient die there. I know that my competence is limited, so knowing your limitations and sending it to the next colleague should be part not only of medical education but medical ethics, which we do not sometimes do. I can handle gynae, I can handle ophtho, I can handle everything, but I am not able to. So the whole system in the hospital, I mean, we work 6 days a week, no government hospital. ILBS works 39 days extra, no holidays like this. But people enjoy. In last 3 days, 3 transplants, one after the other. But nobody asks us. They keep doing because now it is in autopilot. What I am saying is the trust is important if the culture of the whole place is made. And the culture will also depend when you let the people say, sir, आप गलत हो, आपको नहीं आता, मैं आज पढ़ के आया हूँ, ये better. When you ask me the research and all, the most important part is let your youngsters tell you and you learn from them and unlearn what you have made a mistake. If you don't do it, the medical profession. And you touched a very important point कि the healthcare is cheapest. अच्छा ये बताओ कोई lawyer Supreme Court वाला है वो कितने पैसे लेता है? एक appearance का a lawyer in a Supreme Court, you know better.
The top guy
Top
takes
lawyer.
50 lakhs.
50 lakhs. And how much is the top doctor would charge? I am not in practice. Maybe few hundreds or maybe thousands. But people will still go to the top lawyer with distinct. यार हार भी सकते हैं कोर्ट में केस हार भी जाएगा जी, but still you pay. But here, and this is what I think the media should do. In my mind, they should say, doctors, the top doctors only charge this much, but they are human beings. They can fall. They are not infallible. And therefore, the most important part is to let people know, and there are only 2 used to be professions, lawyers and doctors. Still, I think they are amongst it, or maybe bureaucrats. It's a good profession. You have all the keys. But otherwise, as a profession.
That is service.
Service. But lawyers and doctors, lawyers get this much, doctors get this much, and also the beating of the public.
But then probably we chose our
We
profession.
chose,
and,
but we
and
need
will
to
have
make that our children
and we
get-
enjoy it, we will live with it.
Our children get it as much as they deserve to be with respect. It's the responsibility of the society to respect doctors. And I know all of you are sitting here to communicate this to everyone whom you know. Respect your doctors, trust them, and doctors as internal part, we should learn, we should improve, and we should communicate better.
Without trust, actually,
Just to respond to this very interesting point that you made towards the end, I never thought of comparing a lawyer with a doctor. But now that you have pushed me into it, in terms of a practical thing, there is no question of not respecting a doctor. My life is in your hands. When I pay a lawyer and he argues in the court, I know what he is saying, I'm there. If we can create a situation where everybody knows exactly what a doctor is doing and how my patient is being treated, that trust will be there.
yeah. So again comes to communication. Mr. Mishra, now you have been at the forefront of policy change so many initiatives of the Government of India in the last decade. And the 2017 policy, which shifted or also brought in the focus to wellness, prevention, prediction, apart from just illness. I think that happened during the time you were the Secretary, Health, Government of India. And you have observed from a vantage point, you probably would be able to get a 360-degree view of the topic that we are speaking about. What are your thoughts on this? How would you put it forward? Because here, even though doctors are trying to do their best, hospitals are trying to do their best, thousands of crores of investment going into the system, patients getting treated, recovering, yet there are gaps. How can those be filled? What is your take on this?
Thank you. Thank you so much. First and foremost, let me confess, this discussion today is music to my ears. As a public servant, tried this discussion several times and met up with a wall in complete denial. For the first time, unanimously everybody across the board says there is an issue with trust. And I don't know. People say trust is a good doctor, trust is this. I think trust is if you feel like going to him. Because this is not a consumer choice. You are forced to go. So if you are forced to go somewhere and you like to go there, that is trust. But the other issue that we must keep in mind is, the very fact that we are discussing trust today means there is both a lack of connect and a structural issue with the way we function. And leads me to a question, is there a crisis of confidence in the health industry today? If it is not, then why are we not creating enough, in the ecosystem to make a person, if not trust you, at least believe in you? You know, it's about connect. If the medical world can create a proper connect, there is nobody who will feel, let down or whatever. To me, everybody trusts you until you break it. And that is the point we must always remember. It is not everyone who's not trusted. Therefore, to use a sweeping statement that there is a lack of trust is wrong. And this whole conversation seems to be around the private sector. What about the public sector? The mistrust there is for a different reason. There it is about access, there it is about availability, there it is about attention. And why are we blaming money for trust? If X is going to a Y hospital with his eyes open, we should not bring in the factor of money to say that he does not trust that hospital. The problem is, when he walks into a hospital, he knows what he is paying for. The crisis is that he walks out of the hospital paying for something that he did not know. In simpler words, he has no idea about what is happening to him there. Why are we creating this system where he does not have an idea of what is happening to him? You know, we've come a long way in this country in the healthcare delivery system, whether it is simple things like MMR, IMR, or polio, TB, or hepatitis, whatever. The problem today, one of the trust reasons is, as somebody said, subspeciality. Everybody is busy treating a disease, nobody is treating a patient. I mean, and this all stems from one thing. I'm sorry for saying it, this is a wrong place to say this. As long as we keep treating healthcare provisioning as an industry, we will grapple with these problems. It's not treatment that is critical, it's healthcare that is critical. And as long as we can focus on that, I think, we will move. And it's about integration. You will be able to generate far more trust and confidence in the system the day we are able to integrate the public and private sector effectively. Dr. Sareen just spoke about other systems. I mean, we may say whatever we want to. Even today, in majority of the rural areas, the first port of call is the quack. We are talking about places where there are hospitals. Majority of the people are getting treatment in other sectors, in other systems, sorry. There's nothing wrong or right about it. What is it that has created a trust for me in, let us say, Ayurvedic treatment versus an allopathic treatment? Something must have happened somewhere in my mind. So now today, as a hospital, we need to get into an atmosphere where we can convince everyone that this is the right kind of treatment for you. And for that, both Dr. Amrish and Navika mentioned, the critical issue is communication. And the feeling is, it is not that you don't know how to communicate. It is that you don't want to communicate because you have more to conceal than to give. This is a misnomer, but this is the perception. And if you can't correct perceptions, I mean, in a country where there is shortage of provisioning, where is the choice for the patient? And in a situation where the patient does not have a choice, what is trust? I mean, we need to get our hands into it. It is not the patient who is not trusting. It is we who are not able to generate that trust. And let us get that very clear and not blame people for mistrusting.
Thank you. Thank you very much for putting it quite differently. I think we are coming to the end of our time. And last thoughts from everyone, starting with Amrish.
So I'll quickly make
Final
few
thoughts.
comments. Yeah.
Yes.
One is, yes, we agree that connect is most important. If two people are equally qualified from the best institutions, one succeeds, one does not succeed, it is mainly the connect that that person has with the patient and compassion. I totally second what Rajiv said about audits. It's a huge lacuna. There's no way that I can find out which hospital has the best results for IVF or for knee replacement or for any there's no way of finding out. I can't find out. In my position, there is no single way of saying these are which is the norm everywhere. So we need to know, transparently what are the results. So audit, I think, is really important. Audit to be accessible in limited ways to all kinds of people, but it's, I think, really. I think one point that Dr. Sareen made it echoes very strongly something that I always tell my juniors and youngsters is humility, ability to accept your mistake. And we do that every day. So 2 answers patients don't like. This is shown the world over. Number 1, I don't know. And number 2, don't do anything. Okay? And every day there are at least half a dozen times I give these answers. I don't really know at the moment what you have. There are 2 options. One is, in some patients, I'll say, leave behind your papers. Let me think over it with the team and I'll get back to you. Someone will call you in 3 days. The other is, I'm pretty sure it's nothing sinister, so wait and watch for next 2 weeks or 3 weeks and then we'll take it from there. But by and large, the second answer, patients don't like. They want you to do something, not doing something. And also, clearly they say, but we came from 1,000 kilometers and you're saying you don't know. Well, I said, I can't figure out right now. So I think that ability has to be there, and I think that makes a big difference. Greater transparency. And the last point, which is a very sore point with me as being largely in chronic care, is the fact that both insurance companies as well as individual patients are happy to pay for acute care, probably because they have no choice, 10 times the amount, but they won't spend 10% of that in maintaining their health and in chronic care, so they don't get into that situation. I mean, there's reimbursement for transplant and for bypass surgery, but there's no reimbursement for OPD care to prevent those things. So there is some big gap there.
Thank you very much. Navika, final thoughts, some suggestions, some prescription?
Well, I would really like to emphasize on the issue of credibility. There are big hospitals, there are small hospitals, there will be good doctors, bad doctors, there will be the entire gamut available. But credibility of a health system is very important. Brand name, if you talk the Times Group, Times of India, Times Now, there is a credibility that is associated with it, and it is that credibility that builds the trust. So to my mind, in any field, credibility is important, and people do that individually. For people like me, let's say I'm an anchor, I do a show, they will tune in because they find what I say is credible and they can trust me that I'm analyzing it well. For doctors, it works for their work. So one thing is that credibility needs to be maintained and preserved as the most important brand value item for corporatized healthcare world. And therefore, credibility is something that must be guarded. The point Rajiv ji made, I completely agree with it. And if he says that he gave 2 instructions to the doctor that you have to worship the the relationship with, ऐसा नहीं होता है real world में, हमें भी पता है. That's utopia. What you're talking about, maybe 1 or 2 people may come with that values, but there are targets, sales targets that are given. Yes, I agree with you that we need to be sustainable in profits to run the system. Times Group is not an NGO and it's not a not-for-profit institution. It has to make profits to be able to maintain that. But profit at what cost is a line that we have to define for ourselves. These are individual lines. Having worked, I mean, just like there are enough inducements available to doctors, inducements are available to professionals in every field, in every walk of life. How you choose the individuals who represent your brand name and how those individuals literally defend that brand name, increase its credibility is really the struggle here, even in healthcare. And I think that quest has to continue. As of now, the trust that I'm willing to give as an individual is there for the taking. However, the credibility and the commercialization are huge areas where attention needs to be paid. And as I said, communication, we've all recognized. apart from communication, that little bit of hand holding, because a human being is not a sum total. I mean, doctors think it is, but we are not a sum total of 2 kidneys, 2 lungs, 1 heart, 1 stomach, some intestines. We are not a sum total. We are human beings, and that's how we understand it. तो थोड़ा सा, just accommodate that, because you think that this is not my area. This is your liver which is misbehaving. So go to somebody else. Bhai, so please, I mean, doctors, I completely respect specialization, and it's not that I'm saying anything against specialization. We need specialists. But please don't treat us as a sum total of some organs put together. We are individual human beings, where all of this is connected somehow, and this is connected to the brain. तो हमें ऐसी भाषा में समझाओ जो हमें समझ आ जाए.
Rajiv, final thoughts?
Yeah, I think very interesting remarks, and I just want to add to a couple of more points. As Navika ji said, हमें simple भाषा में समझाओ, because at the end of the day, everyone is talking about one thing is communication. चाहे आप हिंदी में समझाओ, अंग्रेजी में समझाओ, but सरल भाषा में समझाओ. And the most important component where I think trust is broken down is more on the billing aspect of it. I think in our corporate world, if we can bring more transparency, and patient should know कि वो किसके पैसे दे रहा है, value for money क्या है. जैसे डॉक्टर अमरीश सर ने कहा, और इसका the point which he mentioned was right, like, and I just want to recall one thing. We always choose which hotel to go, which place to go for a cup of tea, or which we can afford, which we cannot afford. We all in our subconscious mind, we are aware of it. मैं यहाँ जाऊँगा तो मुझे ये देना पड़ेगा. When patient walks into a so-called corporate hospital, is aware that he will have to shell out a particular amount of money. He is also not expecting a free treatment. The problem is that we are not communicating what he has to pay, whether he is paying for the right treatment, right choices, or somebody is talking to him. So I think we need to strengthen communication and billing transparency. I think we will cross this bridge of so-called mistrust which is there in the society. Last but not the least, I think FICCI, which has done a phenomenal job of getting this topic on board, this should not be the last time we are discussing this. This is a journey. This is something which we have started, and it should become a frequent topic for discussion. And if some people can continue this as an agenda, I think it will be, this is the need of the hour. This is not just one episode which we should stop at. Thank you.
No, we'll keep taking it forward. Professor Serene, last thoughts, sir.
Yes. Thank you. First, few topics which you can take. Pharma is coercing the doctors. This was more common in the US and in the Europe. What they did was they changed the system to what is called as a disease forum. This is a very new development. So let's say you have a new drug, GLP-1 agonist, weight loss. So there are 4 parties to the drug trial. One is the pharma, one is the investigator, one is the FDA, and the most important is general public. So if there is a drug development, the public says we want this. The company says we want this. The doctor says we don't want this. FDA says we want. So all the 4 groups, and I have proposed it to the drug controllers, that we should have disease or organ forums where public is involved into what is new and coming. It is so difficult to undertake a new drug trial or undertake studies, like you are fully aware. That's part 1, to have disease forums. Number 2, I also totally endorse what Rajiv says about the clinical audit and this. We are not publishing our audits, and we should. We have to give faith to them. I fail 10% of the time, but 90% I succeed. That 90% in medicine is a very good number. Patient comes to our ICU and says, "Sir, बच जाएगा, आप तो भगवान हैं." अरे भाई, बीमारी इतनी है, he is just not likely, he is on ventilator. नहीं sir, आप ठीक करिए. If you tell them that you are likely to survive 5% or 10%, he would be so disappointed. but somewhere we have to say, and then they say, sir, हमें बताया तो था. So I think that transcription of knowledge to them is difficult, but must be done doctor by doctors very carefully. Third, for doctors, and I have my very dear friends, you should never say, patient comes, sir, उस hospital में है, हमें मालूम है आपके आएगा, ठीक हो जाएगा, आप ले लीजिए. The first thing we should say, that team is as good or better than us. Please do not transfer a patient. Do not come to me. He says, nahi sir, aap hi kya aana hai. See, the transfer is difficult. But be honest and be respectful to the teams who are looking after a doctor. Do not say I am better than others. This is my very humble suggestion to all doctors around. And last part, एक शेर सुना दो.
Please.
सुना दो. दो सुना दो.
इरशाद,
एक तो सुनाई दो.
इरशाद.
जो राजीव ने कहा है, this should not be the first. To me also, this session has brought in light, we never sell in a way our good things. आपने इस होटल में जाना है, हिल्टन में गए, यार हिल्टन है, पर आपने कभी नहीं ये सोचा कि we sell good points of medicine and doctors. तो एक शेर है, आज से शुरू कर रहे हैं. यह मत सोच कि जिंदगी में कितने पल हैं, यह सोच कि हर पल में कितनी जिंदगी है. आज से शुरू करेंगे फिकी to carry this forward into many other forums of building trust, and by the end of 2 years you will have more trust in doctors and all of you will take it to other people. Thank you.
CK.
A great discussion. You know, I think everything stems from what policy perspective as a nation you want to follow. Do you want to create a health system in a nation which is very good of curing diseases? Or do you want to create a society where we are able to prevent a disease? In the former, the cost to the country is very high. And that is where, because of the treatment issue, many of these trust issues that we are discussing today arise. So as a country, we have to take that call. You know, we have heard this issue saying कि सरल भाषा में समझाना चाहिए. उतनी ही सरलता से पेशेंट को समझना भी चाहिए. If you can do that, half your job is done. It's nobody's case that if you are providing a service, you don't deserve a payment. The case is the payment proportionate to the service that you have provided? That is the simple thing. And for that, to explain that is the most difficult part. And there's only one thing that can help, that is complete transparency in what we are doing. You know, it is not as it is in this country, more than 60% of the people go to the private sector. Of course, hopefully, with more investment in the public sector, things will change, and it is changing. It's not changing, it's changing. And there's nothing wrong or right either about the public sector or the private sector. It is all about, and one issue, since Dr. Sareen is here, I think NMC today and the MCI yesterday, and I've been saying this time and again, you teach every medical thing that you do, but also train your doctor to interact and communicate. If that becomes a part of the curriculum, many of the problems that we face of trust will be resolved. And finally, I think we have globally one of the best systems in terms of the quality of doctors and delivery. Only thing that we need to seriously think about is when we deliver, we should deliver responsibly. Thank you.
Thank you very much. Thank you very much. I think everyone will agree we've had a very vibrant discussion, honest, transparent, coming from the heart. Everyone spoke what they wanted to. And to Dr. Sareen's point, FICCI will take this forward along with other organizations. And शेर का शेर से जवाब देते हैं कि मंजिलें उन्हीं को मिलती हैं. एंड यहाँ ऑर्गेनाइजेशन हो, इंडिविजुअल हो, मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है. पंख से कुछ नहीं होता, हौसलों से उड़ान होती है. तो इसी हौसले से हम आगे बढ़ेंगे और इसको आगे ले जाएंगे. थैंक यू वेरी मच.
I know last word host ka hota hai, but
Absolutely. नहीं.
as this session ends, from the public and as I'm representing public today, you know, we discussed trust, but आप ना होते तो हम ना होते. कोविड ने हमें ये दिखाया है, आपने जो किया है सर आँखों पर, आगे भी सर आँखों पर ही रहेगा. Doctors as a community, we salute you and the human service that you did to mankind, humankind in these years. So we can discuss anything, but we do appreciate the torch that you carry, and each one of us in our hearts worship you.
Thank you. Thank you so very much from all the doctors here and the fraternity. Thank you for those words. Over to you.
Thank you so much, sir. And definitely the crowd over here trusts what FICCI trusts. And as your assurances, we will come back in 2 years of time and see that trust imbibed in everyone in your fraternity. And thank you, ladies and gentlemen. You can move for the lunch. The delegates are right here next to the hall. And for the speakers, we request you to join us on the first floor on Jacaranda. Thank you so much. And we come back over here at 2:30, 2:25, so that we can start at 2:30. Thank you.